Good morning, students.
Good morning, sister.
Yes, as we discussed yesterday, that today we are going to go through and do the simulation on magnesium sulfate administration. Right. And the scenario reads, Mary Mlenga, a 32-year-old woman, gravida 1, para 0, at 34 weeks gestation, presents with severe headache, blurred vision, and epigastric pain. Initial vitals, blood pressure, 170 over 110 millimeters of mercury, heart rate, 95 beats per minute, respiratory rate, 18 breaths per minute, and oxygen saturation, 98%. The task. You are asked to prepare the loading dose of magnesium sulfate, 14 grams, and administer. Is that clear?
Yes.
The scenario is okay?
Yes.
Okay. Who's ready to present?
I can present.
Okay. So Faith is going to present. You need to allocate tasks to your fellow students. You can start.
Good morning, my fellow students.
Good morning.
So, as I'm going to administer magnesium sulfate, I'm going to need your assistance with something. So, Juliet, you are going to help me with cannulating the patient.
Okay, did you say I cannulate?
Yes, I said you cannulate the patient. When you are going to help me with catheterizing the patient.
Okay, did you say I catheterize?
I said you catheterize. Then after I administer, you are going to help me with monitoring the condition of the patient using the magnesium sulfate chart.
Okay, did you say I monitor the condition of the patient?
That's right. Good morning.
Good morning.
How are you feeling today?
Just having a headache.
You're having a headache. So my name is Faith. This is from Chilonga College of Nursing. May I know your name?
My name is Mary.
Mary. So Miss Mary, according to how you came, according to how you were presenting, we did some investigation and a diagnosis has been made. So you have been found to be having pre-eclampsia. So this condition is a condition that has the same symptoms that you are explaining. So I've been assigned to administer a drug to you that will help to prevent complications of this condition. One of the complications is convulsions. So this drug works solely to prevent those convulsions, which will help to prevent brain damage to you and to the baby. So I'm kindly asking for permission if I can go ahead.
You can go ahead.
Okay. So before I go, is there anything that you want me to do for you within my reach?
No.
How about where you are sleeping? Is it okay? Is it dry? Are you comfortable?
I'm comfy.
Let me just confirm, okay? Yeah, okay. Yeah, you can be lying on the sides. Yes. So thank you for allowing me. So as I will be administering this procedure, I will have to insert an IV access. So I'm going to assign my friend who will come and insert an IV access, and we also have to monitor urine output. Right? So two of my friends, one is coming to insert a cannula and one is going to insert a catheter. Okay? Oh. So I'll be coming. All right. All right. Okay. So my drug chart is saying magnesium sulfate, 14 grams. This is my magnesium sulfate in stock, a 10 ml ampoule, 500 milligrams per ml, making it 5 grams or 50% magnesium sulfate, which is expiring in 2029, which means it's still potent for me to use. As I had mentioned before, the strength in stock is 50% magnesium sulfate 500 milligrams per ml in a 10 ml ampoule. Making it 5 grams or 50%. Then the doctor's orders are as follows: 14 grams loading dose. Then the way we are going to give this loading dose is 4 grams is going to be given as 20% IV slowly. Then 10 grams is going to be given as 50% IM with 2 ml of 2% lignocaine. So I'm going to start with calculating 4 grams so that I reduce it to 20%, since in stock we only have 50% magnesium sulfate. So first of all, I'm going to have to calculate how many mils make 4 grams of 50% magnesium sulfate. Since 5 grams of 50% magnesium sulfate, they are found in a 10 ml ampoule. So I'm going to use the common formula for finding the dosage, which is dose is equals to doctor's order over drug in stock times volume. So dose is equals to, for IV dose, our IV dose is 4 grams. So dose is equals to 4 grams over 5 grams times our volume is 10 ml. 2 times 4, which is our dose is equals to 8 ml, but our 8 ml is still 50% magnesium sulfate. Now I want to calculate the amount of water that I need to dilute this 8 ml so that I change it to 20% so that we can be able to administer our drug. So my formula for finding the amount of water that I need to dilute with is strength available divided by strength required minus 1. So what is our strength available? Our strength available according to our ampoule is 50%. And the so as I had said in the formula, all of it minus 1. So 2 into 5, 2 remainder 1 into 10, 2.5. So that this is where we are going to get 20 into 50. This is going to give us 2.5 over 1 minus 1. 2.5 minus 1 is what? 1.5. So we're going to so our answer is telling us that 1 ml of 50% magnesium sulfate is diluted with 1.5 ml of water for injection to give us 20% magnesium sulfate. So now that we have found our 1.5 to be the amount of water that has to dilute 1 ml of 50%, we now get the dosage that we had gotten here. We said our dose is what? 8 ml of 50%. So 4 grams is equals to 8 ml of 50%. How much water do we need to dilute this 8 ml of 50% so that it becomes 20% magnesium sulfate? So we use simple proportion. If 1 ml is equals to 1.5, how about 8 ml, which is equals to more? So bigger number on top times 1.5. 8 times 1.5, it's going to give us 12 ml of water for injection. So 4 grams, we dilute it with 12 ml of water for injection. So we're now going to get our 8 ml, which is equivalent to 4 grams 50%, plus 12 ml of water for injection, which will give us 20 ml of now 20% magnesium sulphate. So 4 grams of 20% magnesium sulphate is equals to 20 ml. That means we're going to withdraw 8 ml from this ampoule, then we withdraw 12 ml from an ampoule for water for injection to make our solution, then give. Now I had explained to say our intramuscular dose, we're going to just give it as 50%. We don't have to reduce it or anything. So this 10 grams, since we said 1 ampoule, it contains 5 grams, we're going to take 2 ampoules, and each buttock we're going to be injecting 5 grams or 50% with 1 ml 2% lignocaine. So as we said that 1 ampoule is containing 5 grams, that means we're just going to get this whole ampoule we inject, and this whole ampoule we inject another buttock. That's how we are going to give our IM dose. So I'll get my drug so that I go and dilute now. My needles are expiring in 2027, potent for me to use. So this is a 21 gene needle which is needed for deep IM administration. Since I'm done preparing, I'll go and scrub. So now let me just first connect my needles with the syringes. So this is my 20cc syringe that I'm going to be using for administration of the intravenous dose. So in this 20cc syringe, I'm going to put 8 ml of magnesium sulphate and 12 ml of water for injection, as we had discussed. I have diluted my 8 ml of 50% magnesium sulphate with 12 ml of water for injection, which has made 20 ml of 20% magnesium sulphate, which is equivalent to 4 grams. So since this is IV, I'm going to remove my needle and so now I'm preparing my IM dose. So since there is space here, I know that this ampoule has 10 ml, right? So I'm just going to first withdraw lignocaine that needs to be 1 ml. So this is 2% lignocaine. There's no need for dilution. So 1 ml lignocaine I've withdrawn. Then I withdraw everything that is in here. So in this syringe I've withdrawn 5 grams or 50% MgSo4, which I've mixed with 1 ml of 2% lignocaine for IM dose that I'm going to inject in one buttock. So next I'm also going to withdraw another 5 grams that I will inject in another buttock, since we said 5 grams each buttock. Huh? Okay. So the same routine. The first 1 ml it's going to be occupied with 2% lignocaine. Okay. 2% lignocaine withdrawn. The second ampoule for magnesium sulphate, which we are going to withdraw 10 ml, which is 5 grams or 50%. The second shot for 5 grams magnesium sulphate for the other buttock. So our drug is ready now. All we need is to go and administer. Good morning once again. What did you say your name was again? Mary Mlenga. So as I had promised that I'm going to prepare, I've prepared and now I am ready for administering the drug. My friends had come to catheterize. Okay, let me just check the urine output. Okay, since 1 hour had elapsed and I can see this is 30 ml, which means our urine output is 30 ml per hour. That means your urine output is good. Let me just check your respirations. The respiratory rate is 18 breaths per minute, which is okay. So that means I can go ahead with administering the drug. So now I'm going to start with the IV. Okay. 4 grams. I've managed to administer my 4 grams in 10 minutes. So now I'm going to move on to the IM dose. So, Miss Mary, the intramuscular drug, I'm going to need to inject on your buttock, okay? Yes. So let me just go that side. So I'm injecting in the upper outer quadrant to and also deep IM to prevent abscess formation. So now I'll be injecting Miss Mary, okay?
Yes.
Okay. I'm now going to inject the other one in the second buttock. I'll be injecting now. Okay. So Miss Mary, thank you so much for allowing me to do the procedure on you, okay? So this drug that I've given you, it causes some forms of discomfort such as general body hotness, and heartburn, but they are totally normal. It's just the drug that is working. They will come to pass. And as I have assigned my friend, she's going to be monitoring you throughout. So I'll come back again after 4 hours so as to start administering the maintenance dose. For now, thank you so much. Are you comfortable?
Yes.
So if you need anything, we are just going to be around, okay?
Alright.
Thank you so much. Good morning once again.
Good morning.
I've managed to administer magnesium sulphate on patient Mary Mulenga, and before administration, urine output was 30 mL per hour and respiration was 16 breaths per minute, which means she was okay for me to administer. As I administered, the patient looked generally stable and I've managed to give IEC. I've left someone by the bedside monitoring the general condition of the patient.
Anything that you observed on the patient?
No. Patient is generally stable.
Thank you so much.
Alright.